gets this cold, you often think about what? Flu season. And while health experts say this year's wave should be moderate, they're urging all of us not to let our guard down. Joining us now is Dr. Jodie Guest, professor of epidemiology at Emory University, to break down what we can expect and why getting that shot early still matters. Dr. Guest, great to be with you. So moderate, is that what we're hearing this year? What does that mean for us?
Sure. So last year's flu season was terrible. It was really an awful one. A lot of deaths were associated with flu. And so the prediction is that this year's will be moderate. We tend to not have really hard flu seasons back to back.
What strains are you seeing circulating right now, and how well does this year's vaccine appear to match them?
You know, we're still not clear because the flu season is just kicking off, but we have most of the flu strains are what we had last year as well, H1N1. But I do want to be very clear that that does not mean your flu shot from last year protects you this year because of waning immunity. So you need to make sure you get a shot again this year.
What's your biggest concern as we head into the heart of flu season, and anything giving you the most optimism at this time? I know it's early.
Yeah, my biggest concern is the lack of interest in people getting a flu shot. Last year, our children had less than 50% of them were vaccinated, and that was down 20% from the 2019 season. And so that is a real concern. 280 kids died last year in the United States from the flu. So we need to take this very seriously.
Is that just because, do you attribute that to some of the widespread skepticism we're seeing right now in vaccines, or is there something bigger at play here?
It is largely that. You know, we have a lot of pandemic fatigue still, but our increasing disinformation about vaccines is swirling everywhere out there, and we need to make sure we're really meeting that head on and making sure that what we're talking about is we want everyone to be safe and healthy.
All right, so you talked about just how bad last year was. What kind of lessons can we take away from that flu season that can perhaps help reduce hospitalizations this time around? Anything outside of just making sure as many people as possible get the shot?
You know, those who died last year, and unfortunately the numbers are not confirmed, but it's somewhere between 40 to 100,000 adults died of the flu last year in the United States. This is a vaccine preventable illness. So we want to make sure that we're thinking both about our personal protection, but also, you know, those that we love and who we're with, and we don't want to spread the flu to them. But we also need to be very clear that with the CDC having issues with funding and the federal shutdown, we're also largely in the dark at the moment about numbers. And so we're very dependent on individual states or individual health departments telling us about the number of cases. We don't have the national surveillance we normally have to watch as well.
Yeah, I just walked right into my neighborhood CVS a couple weeks ago and got it right then and there. Didn't even have to wait. I mean, it's pretty accessible, is it not? Is it as easy as just finding the neighborhood CVS or Walgreens these days?
It is. And, you know, the hours are good. And so depending on how your work hours are, there should be appointments available for you. And, you know, a CVS, a Walgreens, Publix, all of them have the flu shot. And all of them have walk-ups, as well as you can book your appointment in advance.
It's a good time to get it too as we head into the holidays, but is it ever too late in the season to benefit from a flu shot? And how late does the season actually go?
So the peak season begins usually in February, and so we want most people to get their flu shots in October and November, and that is so that your body can mount its immune response and have it at its peak at the time when we see the majority of the flu cases. But it is not too late to get your flu shot. Now is the right time to do it. If you can do it before Thanksgiving, that would be really preferable, again, so you have the best coverage possible by the time we hit February.
Dr. Jodie Guest from Emory getting us ready for flu season. Thank you so much for your time.